You don't need a bigger facelift to get better results. In fact, choosing the wrong type of facelift is one of the most common reasons patients end up disappointed. But first, let me clarify terminology. A quote-unquote full facelift is not a common or popular term surgeons use to advise patients. It's more accurate to discuss a mini facelift versus a lower facelift, or even more accurately, a face and neck lift. Here's why this matters. I'm a facial plastic surgeon, and I regularly meet people who are told they needed either the smallest option or the most aggressive one, without anyone explaining the difference. When patients don't understand what each procedure actually does, they either overcorrect something that didn't need it or undertreat a problem and wonder why nothing really changed. By the end of this video, you'll understand what a mini facelift actually fixes, what a lower facelift is designed to address, and how to tell which one matches your face, not someone else's. Let's start with the big picture. A facelift is not about pulling skin tight. It's about repositioning deeper facial structures that have shifted with time. Skin is just a cover. What matters is underneath. A mini facelift focuses on a smaller area. Think of it like tightening one section of a loose sheet instead of remaking the entire bed. It's usually aimed at early jowling and mild sagging along the jawline. The changes are subtle to the public, but dramatic to the patient. The recovery is typically a little bit shorter, but it doesn't address the neck in a meaningful way, and it won't correct more advanced facial descent. A lower facelift, or what some surgeons will call a face and neck lift, is more comprehensive and aggressive. It repositions the underlying strut port of the mid-face, the jawline, and neck all together, so everything moves in harmony. This is what creates a natural result that lasts rather than a tight look that fades quickly. One of the biggest misconceptions I hear is, I want the mini one because I don't want to look pulled. Or they think mini means same as facelift, but smaller incisions and quicker recovery. That concern makes sense, but that tight artificial look doesn't come from doing too much surgery. It comes from doing the wrong surgery or doing it poorly. And just because it's a smaller incision and a shorter surgery doesn't mean you'll get the same result as a lower facelift. The key is identifying your specific anatomical aging changes and seeing if a mini facelift is a good option. Another question patients ask all the time is, does the mini facelift hurt less? In reality, discomfort is usually similar. Surprisingly, many patients report no to minimal pain after any facial surgery. That's because the very action of elevating a skin flap disrupts the sensory nerves and you'll be numb post-op. There is no real difference in pain level between a mini lift or a face and neck lift. The difference may be seen in recovery length and how much change you'll see, not how sore you'll be. I also hear, if I start with a mini facelift, can I just do a full one later? Sometimes yes, but doing a smaller procedure that does not address the real issue can make future surgery more complex. It's often better to choose the right solution the first time. And then there's the quiet question many people don't ask out loud. What happens if I do nothing? The answer is simple. Aging continues at its own pace. Surgery does not stop time. It just resets the clock. The goal is not to fight aging, it's to stay looking like yourself as the years pass. Here's the key reframe. The choice between a mini facelift and a lower facelift is not about age, it's about anatomy. Two people the same age can need completely different approaches based on bone structure, skin quality, and their face is actually aging. When patients understand this, the fear usually fades. It's no longer about choosing the big or small option, it's about choosing the appropriate one. A good facelift decision is calm, informed, and individualized. No rushing, no pressure, just clarity. And if this explanation helped you see the difference more clearly, that's exactly the level of understanding I want patients to have before making any decision about their face.